We're going to move on to the front now as part of your prevention against viral attacks and also expelling pathogens. So the first thing I'm going to talk about is lung 1 and lung 2 acupuncture points. To find these, hook the fingers so the index finger presses up against the clavicle. The middle finger, ring finger, and small finger then each penetrate into the gap between the ribs, the intercostal muscle space. And you're going to pull inwards in towards the, let's say, go towards the spine. And you're going to rub this area quite vigorously. Now, please understand that anyone with asthma or pneumonia or a chest infection, these points are going to be blocked and they're going to be extremely sore. So you want to be very careful. You only do it enough for the person that you're working on. You don't want to hurt them and you don't want to overdo it because you're going to disperse a lot of blocked lymph into the system, which might actually start to make them feel worse before they feel better. So we've got to clear this toxic stuff out of the body. It doesn't just miraculously come out. It gets fed into the body and then you get an immune system response to that. So we don't want to do it too much, but we've got to get the thing working. We've got to get it rolling. So up to the clavicle, hook the fingertips in between the space in the ribs and rub. It's going to be sore usually for anyone that's a smoker or asthma. Work on both sides and keep jump in between the two, jump backwards and forwards and stimulate this. If you do it too much, you're going to feel bruised and you're going to feel sore. And if you're doing it on somebody else to help them, they're not going to like you very much and they're not going to want you to do it again. So a little bit, less is more, a little bit, and then a little bit more, and then a little bit more. That's how we do it. That's how we work. The benefit of these points are, especially for asthma, again, pathogens. One of the nice side effects of lung 2 is that it will reduce irritation. So in these times where we might be living so closely together and irritating each other, this just might bring them down a little bit. But remember, if they're sore, they're going to be irritated a little bit more. So be careful and work it. And it works really well with that whole breathing exercise as well to open up the lungs and really expand everything before we get to belly breathing, which is the most important. We've got to have flexibility and movement in the spine.